primary promise, building the nation's model health system for children.
Belle is super fun-loving and playful. She's always happy, such an easygoing kid.
The boys are amazing with Belle. They all want to take turns holding her. You have comfort knowing as they get older, they really will help pitch in and care for her.
When Belle was about 10 days old, she just started throwing up, couldn't keep anything down. She wasn't gaining weight. We had no idea really anything. The doctors kept coming up with different ideas and then they wouldn't pan out. So when they came to us and wanted to do a whole genome sequencing test, they said it could help tell if there was any mishap in her gene. After the test was done, they said Belle has a metabolic disorder called congenital disorder of glycosylation. We were able to really narrow down the specific treatments to help her body grow and thrive.
Personalized medicine is looking at the properties of whether they're metabolic, genetic, physiologic, that are very specific for that patient, that relates to their disease, and finding a therapy that perfectly matches that patient.
Thanks to Primary Promise, our model health system for children, we're uniquely positioned to screen, diagnose, treat, and create cures for diseases that affect children. Our research, population studies, and nationally recognized integrated health system empowers us to discover and actually deliver cures to kids fighting illnesses right now.
In children, the biggest cause of disease are genetic diseases, things where the DNA has changed and we need to understand what that change is. When we started, it was extremely difficult to make a diagnosis in a child. It could take months or years to make a diagnosis. The type of testing we had was relatively clunky. Just to sequence, the small region of DNA for a single gene could take a week and just be hugely laborious. Now to do an entire genome, just on a huge scale, we do it in 3 to 5 days. It's just remarkable to be kind of at that point in medicine to offer this for families. A great example is we had a child show up, they had a seizure, took some images of their brain and could see they had this terrible disease, but we didn't know what was causing it. We sent the whole genome sequencing, and on Monday we had the answer. We need to start this special treatment called a bone marrow transplant, and that treatment will save the child's life. Without that test, without the treatment, the child would die. Really, it's trying to find the right medicine for the right patient, and to choose the right medicine, we rely upon making the correct diagnosis.
In the cancer space, the tumor itself has lots of changes in it called mutations. So you can have tumors very much of the same type in 2 different patients, but they have different changes in them. And there are specific treatments for each one of those changes.
Yes.
Good job, Ruby.
My name is Mark Thacker. This is my wife, Allie. We live here in Sandy, Utah. Got 4 girls, family of girls.
Ruby is known for making friends. Ruby's known for being kind. She loves to leave notes. Dear Mom, you're the best. Or, I hope you have a good day. Or I'm sorry today was hard. That's how her brain works. When she turned 3, they found a little white spot at the bottom of her neck. Said, hey, can you stick around so we can just do one more? I'm like, sure, no problem. We'll go to the cafeteria and get lunch. I was oblivious.
We're so oblivious, yeah.
And then I walk into room 8 and Dr. Holly, she couldn't hold it together. And she said, I'm sorry. She said that she had cancer and it was everywhere, all over her lungs. She rolled through the images on the computer and it was just tumor, 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 tumor. One pressing on her heart.
We sequence the entire genome of the patient, sequence the entire genome of the tumor, and then we take the tumor to the lab and we test it against dozens and dozens of potential therapies.
They said, yes, there's a genetic mutation in the lung tissue. This is the drug that could target that specific mutation. A trial just opened. You can enroll on that and just stay at primaries. She was 4 when she started that drug, lungs full of tumors, and now she's 10 no evidence of disease, not been on treatment for 2 years.
My cancer's kind of me.
Personalized medicine will take us where we need to go next, and philanthropy unlocks this most innovative care. Your generosity takes us out of the research lab and to the bedside, inspiring hope and igniting breakthroughs for our patients and families.
Gene therapy, it's the tip of the iceberg of what we can do and what's coming, but we really need to bring ourselves all together into a single center and build that center.
Philanthropy dollars are the best spent dollars. That is the money that can really allow you to do the most innovative clinical science, the most innovative research.
They really want to make sure that she has the best quality of life and that we as a family do. And they've kind of become our second family. We have nurses that have known her since birth, and they fight for her life and will do everything for her.